So go ahead and get started here. Get my first check going. Can you hold this actually? Or just put it this. So grab my stuff. Go ahead and do my first check. We're doing 0.9% normal saline. We got 0.9% normal saline. It's going to be 125 milliliters per hour continuously. We get a 250 milliliter baggie, and that'll suit us fine for our purposes. Route is going to be IV. We're totally fine with all our equipment here to go through the IV. And the time is going to be 0800. It is 0800 right now. And this is for Susie Q, sick girl, date of birth 1150, and Susie Q, sick girl, date of birth 1150. Allergies to penicillin here. That's alright because we're not giving anything with penicillin. I would open this out of the bag. The expiration here is February 13th, 2022. So our expiration is fine there. We're good. I'll go ahead and do my second check. Everything first check and then calculations. We would go ahead and do 0.9% normal saline, 0.9% normal saline, 125 milliliters per hour continuously. We can do that. IV, this is perfect for IV. At 0800, it is 0800, and this is for Susie Q, sick girl, date of birth 1150. Susie Q, sick girl, date of birth 1150. Looking good. Alright, and then I'll go ahead do my calculations for what we want, which is 125 milliliters per hour from our 250 bag there, and the drip rate is going to be 21, and you can get that from the tubing bag actually. So now that we got our calculations and second check done, go ahead and get our stuff going. I already opened this out of the bag, so we'll go ahead and open the tubing there. Go ahead and clamp this guy. That'll work. Alright. We're going to want to stick this guy in there. I'm pretty sure this had a cap on it before, but I don't know where it got to. And just make sure we're sterile, not touching either one of those with anything contaminated. Make sure that gets punched through the whole way. Go ahead and hang this guy up. And make sure we give this guy a nice little squeeze. Make sure it's about 1/3 to a half of the way filled, but definitely not filled the whole way. I'm just going to make sure we're still recording. Yes. Alright, where was I? Got this going, and this is all not at the bedside so far, even though it looks like it. And this guy would be sterile here, so we don't want to just be throwing that around, but it's going to be dripping everywhere, so now we can start getting some juice flowing. Alright, make sure we keep these guys upside down, give them all a couple punches there. I played around with this thing so much that some of these bubbles are honestly impossible to get out. This last guy upside down, like these ones will never come out, no matter what I do. Alright. We'll just pretend that we got all those out for time's sake. And then, make sure we reclamp that so we got everything set up. You just hold that. Alright, then we can go ahead and bring all our stuff into the patient room. So we're here in the patient's room now. Hi, my name's Gabriel. I'll be your student nurse from Hack. Could I get your your first last name and date of birth, please? Alright, Susie Q. Sick Girl, date of birth 115 or 1150. So we're good. Verified. Do you have any allergies I should know about? Penicillin. Alright, we're not going to be giving any penicillin today. Go ahead and close the curtain. And throw some gloves on. And go ahead and assess the IV site for any redness, swelling, any heat. I don't think it would be infiltrated since we aren't running anything currently. But then you would check for the coolness, and then any localized pain. So we have none of that going on. And then we can go ahead and do our third check, which I suppose we would be using the computer for. But I'll just go through it here. So we got Susie Q. Sick Girl here, date of birth 1150. This is for Susie Q. Sick Girl, date of birth 1150. We're doing 0.9% normal saline. We got 0.9% normal saline, 125 milliliters per hour continuously. We're good to go on this 250 milliliter bag. That'll just be 2 hours then, and then we'd have to switch it if it's continuous. It's going through the IV. We got everything set up, good to go through an IV. It is set, supposed to be administered at 0800. It is currently 0800, and we are not doing any penicillin. Okay, got the third check going. So I'll go ahead and clean this guy. 15 seconds, alcohol swab, really get in there. And we're gonna want to flush that. So we're gonna clean that. Go ahead and unclamp this guy. Sorry. And go ahead and give it a 3 milliliters will work. Just flush it through. Really, this one doesn't have no. That's fine. So we got that thing flushed. Then just a second. Alright. Put on that. And then we said we want this to be 21 drips an hour, so we'll go ahead and get it to about 5 drips per 15 seconds. Which, that looks pretty good there. Alright, so pretty sure we're good. Make sure the bed is in the lowest position, call bells within reach, bed rails are up appropriately, and check back on that guy to make sure it's not infiltrating or anything. Should be good, bro.